Good afternoon, guys. I've got your A for you. We're discussing older adults living alone and dying alone without family or caregivers. So I'll go through presentation A for you. And this one also, I'm going to do 2 shows about this subject. So this is A. Here we go. The headline points to a real and growing social and medical problem. More older adults are living and dying without close family or caregivers, and health systems and communities are struggling to respond. What the page content shows. The surrounding coverage frames this as a trend driven by demographic and social change. A rising share of older adults now live alone, and many have no spouse, children, or nearby relatives to provide end of life supports. And that reality fuels fears of dying alone and makes the situation more visible to reporters and clinicians. Journalists and health commentators describe the phenomenon as increasingly common rather than rare. How common and who is affected? The reporting and background pieces emphasize that millions of seniors live alone and that loneliness and social isolation are widespread among people age 65 and older. The pages cite surveys and population figures showing a substantial and growing cohorts of older adults without traditional family support networks, including those who are childless, widowed, divorced, or geographically separated from relatives. What professionals are seeing on the ground? Healthcare providers and social service workers are encountering more cases where older patients have no one to call in a crisis, no one to hold their hand at the end of life, and no informal caregiver to manage daily needs. Coverage notes that hospitals, emergency responders, and long-term care systems are increasingly confronted with patients who die alone or whose deaths are discovered late because they lack close contact. Health and social consequences. Isolation is not just an emotional problem, it carries measurable health risks. Chronic, chronic loneliness and social isolation are linked to higher rates of heart disease, dementia, and premature mortality, and they worsen outcomes for chronic illnesses common in late life. Honor the combination of medical vulnerability and lack of social support raises the stakes. Isolated seniors are more likely to experience preventable decline and to lack advocacy when making care decisions. Systematic gaps and responses. The surrounding content highlights gaps in policy and practice. Medical systems are not uniformly prepared to provide compassionate end of life presence for people without family, and social services are unfunded relative to scale of need. Some articles call for practical responses, better screening for social isolation, community-based volunteer programs, stronger palliative care, outreach, and legal planning supports. So that preferences are known and honored when no family is available. The headline summarizes a multi-layered crisis. Demographic shifts have increased the number of seniors without close caregivers. Isolation worsens with health outcomes, and current health and social systems are unevenly equipped to ensure dignity and companionship at the end of life. Okay, guys, that's your A for now. I will be back on with B shortly.